Excellencies, ladies and gentlemen, Ambassador, it is a great pleasure for me to stand before you here today on this very unique and very special occasion when we celebrate Day of Yoga. And today we are linking yoga to health and well-being of all the people and the planet. It is really a very old tradition. It's a 5,000 years old legacy from India. And it's a very rich tradition. And I have been privileged in my time of living and working in India and working with the government and with the people of India to see how deeply this tradition is rooted in the culture of India and how different it makes the entire nation. It is transcending physical activity to integrate the mind, body, and soul. And everybody knows in this room, I'm sure, that yoga is not about physical activity, and it's not about those difficult exercises for some of us to do. It's about our ability to feel yoga, to feel it in our souls, to connect it to our minds, and to integrate not just between ourselves, amongst ourselves, but also with the nature, with the planet. Yoga is about self-acceptance and self-discovery. And it's a journey of the self, to the self, and through the self. Ladies and gentlemen, pay attention to the meaning of this. It is about taking time to understand ourselves, to understand from where we are coming from, to connect to where we are, to discover what we are here for. And that is what brings this unique calmness to this nation, which has surprised and helped me to live my life during my period in India. Yoga is, of course, a practice which can be relevant to all ages. It is relevant to all cultures, irrespective of what socioeconomic status people represent. And it can be used to unite our complex and difficult world and to promote not only healthy lifestyles, but also peace and security in the world. As a comprehensive and a holistic module for health and well-being, it provides not only physical and mental, but also spiritual benefits to all of us. And it is consistent with a healthy lifestyle and its significance in promoting health and well-being that WHO is standing for. Many of you know that yoga can play a very important, almost a key role in fighting against the growing burden of non-communicable diseases, the diseases which are chronic diseases and which are so much affected by the way we live, by the way we behave, by the way we make our choices in terms of consumption of various foods and drinks and healthy lifestyle at large. Yoga has proven to reduce high blood pressure. It is also prevents cardiovascular diseases. There is a scientific evidence to prove that, ladies and gentlemen. And it also reduces risks of type 2 diabetes, including glucose tolerance, but also insulin sensitivity. It also improves the lipid profile, which many of us in different times of our lives suffer. And it also improves anthropometric characteristics. Practicing yoga can also reduce oxidative damage that we are all experiencing. It also improves blood coagulation profiles. It also strengthens our pulmonary function. It helps us breathe better and therefore live longer. And it decreases many other risks also, which are associated to chronic diseases, non-communicable diseases. Today, yoga is so popular across the globe that I don't need to add my words to that. But it is not just because of its efficacy in the prevention and management of some diseases that I have just listed to you, but it also because it provides strength and relief to the practitioner of yoga, not only from the chronic type of physical pain, which we all know what it means, but also from emotional distress, from the mental distress. It helps us to overcome challenges that modern lifestyle puts on all of us. WHO carries this year, in 2017, World Health Day campaign, which is associated to fighting depression and mental health. I cannot think of any other so powerful concept that can prevent depression as yoga. And it is important that we all recognize those very unique and very powerful healing effects of yoga, particularly as an effective tool in managing stress and strengthening mental and emotional well-being of our societies. This is also very relevant to millions of people who are experiencing distress in the situation of crisis, man-made or natural crisis situations. It is essentially the skill that is always with you, even if you are displaced, even if you are migrating, even if you are in a very difficult condition, yoga is always there with you. So that's why it is so precious, and it is so important that United Nations every year takes a special day to celebrate yoga. Across the world, traditional medicine is already quite mainstream in healthcare delivery. In some cases, it complements the traditional medicine. Traditional medicine is an important and often underestimated part of healthcare, but it can very powerfully contribute to all people and to ensure access to services and good health outcomes. WHO has made many attempts to integrate traditional medicine with the allopathic medicine, and we are seeing now in many countries that where universal health coverage is promoted as a concept to equally improve health of everyone and leave no one behind, yoga and many other various traditional medicine practices are already very much part of that service delivery in many countries. So we are trying to integrate traditional and spiritual approaches such as yoga and make them work to achieve the SDG goal number 3 about health and well-being of everyone, everywhere. We do it through generating scientific evidence about yoga, not just hear and say, not just a practice which goes from generation to generation, but we are already having a number of WHO scientific collaborating centers in the United States, in India, of course, in Italy, in Norway, in many countries. And these centers, on the scientific level, contribute to our better understanding how we can use yoga to prevent spread and growth of non-communicable diseases. As you can see, the benefits of yoga in physical and mental well-being have been quite well established, and it has incorporated yoga already also in a medical curriculum of educating medical practitioners, because it is very important that we see yoga finding its place in the initiative of well-being in the workplaces to improve occupational health of us and of ourselves and our colleagues. It is much needed also as an intervention to increase our resistance to the lifestyle health problems and rising cost of curative treatments. Ladies and gentlemen, we can reduce cost of those treatments by preventing diseases from happening in the first place. Yoga, at its core, is a holistic and integral science of life. It deals with physical, mental, emotional, and spiritual health in both individual, but also in the society. And it makes it worthy practice for people of all religions, races, and nationalities, because yoga is not a religion. Yoga is a lifestyle. As the international community works towards achieving SDG goal, we are all lined up to see how yoga can play a role at individual but also at a collective level and promote harmony between health, societies, environment, in a sustainable but also in an inclusive manner. Yoga helps us to integrate better with the nature. Yoga is that makes us understand why and how we can protect our nature and contribute to reducing effects of climate change. In its current conflicts, of more conflicts and humanitarian emergencies than ever before, yoga has been unifying concept that has brought peace and harmony in many parts of the world. I thank you very much for the opportunity to participate in today's event, and I invite you to enjoy and benefit from the power of yoga. Thank you.